Hi everyone, my name is Liz Arias and I'm going to explain to you about the Targt gene therapy platform for correction of anemia in end-stage renal disease. Definition: gene therapy is an experimental technique that uses genes to treat or prevent disease. In the future, this technique may allow doctors to treat a disorder by inserting a gene into a patient's cells instead of using drugs or surgery. The technique remains risky and is still in the rush to make sure that it will be safe and effective. Now, a short video.
So, what exactly is gene therapy? First, let's start with the basics. This is a gene. Genes are made up of DNA, which are the blueprints to build the enzymes or proteins that do the work for your body. As far as we know, humans have between 20,000 and 25,000 genes. And most people have 2 copies of each gene inherited from each of our parents. They are the building blocks of our physical makeup, from the color of our hair, to our athletic abilities, to our immune system. But sometimes genes aren't built correctly. And a small adjustment to the DNA within our genes can change how our proteins work, which can affect how we breathe, walk, or digest food properly. To better understand how genes change, here's Dr. Michelle Kalos.
So our genes are mutating all the time as a result of chemical processes in the cell, as well as external influences like ultraviolet light. We can also inherit mutations from our parents. Now, when we wind up with these mutations, they can sometimes cause disease, and that's really where gene therapy comes in.
If genes are like the blueprint to our body, gene therapy can fill in some missing drawings. Gene therapy is the introduction, removal, or change in genetic material, specifically DNA or its molecule cousin, RNA, into the cells of a patient to repair or change a gene to treat a specific disease. The transferred genetic material then changes how a protein, or group of proteins, is produced by the cell. It can reduce levels of certain disease-causing proteins, increase production of disease-fighting proteins, or even produce new or modified proteins within the cell. You may be curious how a gene and the genetic material it holds is transferred to the cell during gene therapy. Well, a gene cannot be directly inserted into a cell. Instead, a carrier, also known as a vector, helps deliver the gene. Typically, viruses are used as vectors because they've evolved to be very good at sneaking into and infecting cells. But in this case, their motive is to insert the gene or genes into the cell. The infectious part of a virus is removed, allowing it to still enter the cell's nucleus without making the patient sick. It's worth noting there are 2 kinds of gene therapy: in vivo and ex vivo.
What is anemia? Anemia means that you do not have enough red blood cells. These ones are in charge of carrying oxygen from your lungs to your body's tissues. If your tissues and organs do not have enough oxygen, they cannot work as well as they should. Anemia is common in people who have chronic kidney disease, and it can make you feel weak and tired.
Welcome back to Medicosis Perfectionalis. Let's continue our talk on normocytic anemia, and today's topic will be anemia in chronic kidney disease. In the good old days, we used to call it kidney failure or chronic kidney failure. Now we call it chronic kidney disease because we do not like failure. Symptoms of anemia are the exact same thing: tired, pale, headache, lazy, dizzy, short of breath, on exertion, angina. The signs will include stuff like murmur due to a hyperdynamic circulation and so forth. Here is your hematopoiesis slide. We start with stem cells and we go to RBCs. So in anemia, we're having problem producing enough RBCs. All of these steps need something called EPO, erythropoietin, from your friend the kidney. That's fine. And as you are well aware that MCV determine if the anemia is microcytic, normocytic, or macrocytic. Anemia related to chronic kidney disease is normocytic, MCV 80 to 100 femtoliters. Okay, but first I would like to answer the question of the previous video. In the last video on aplastic anemia, there was a question. The answer to the question will be D, phenytoin. Now, back to anemia in chronic kidney disease. As you know, the normocytic anemia, where the MCV is 80 to 100, has three main causes: blood loss, underproduction, overdestruction. Of course, the blood loss has to be acute. Underproduction has many causes. Anemia of chronic disease or iron deficiency, we have talked about them previously, each in a separate video. Aplastic anemia was discussed in the last video. Chronic renal failure or chronic kidney disease, that's today's topic. So let's jump in. So anemia in chronic kidney disease starts at stage 3 chronic kidney disease and is almost universal by stage 4. What are these stages of chronic kidney disease? They are stages depending on the GFR in the chronic kidney disease case. I've discussed them in a separate video called the 5 stages of chronic kidney disease based on GFR. I will link it in the description. What are the causes of anemia in general in cases of chronic kidney disease? A lot of them. Relative EPO deficiency, bleeding problem, chronic inflammation, and the link between anemia of chronic inflammation and chronic kidney disease is discussed in my video on anemia of chronic disease. Pardon me. So anemia of chronic inflammation is the same thing as anemia of chronic disease. We have folate or B12 deficiency, hemoglobinopathies, and immunosuppressive drugs. Okay, how to treat? There is a new thing right now called the recombinant human ESA. ESA stands for erythropoietic stimulating agents. This is EPO made artificially. We give them to people who are deficient in EPO. Some athletes abuse EPO to get more RBCs, to carry more oxygen, to perform more exercise. Dialysis and renal transplant, of course, if chronic kidney disease has stages like 4 or 5, especially 5, which is the end stage kidney disease. Renal transplant, B12 and folate. Why? Because one of the reasons or the causes are B12 and folate deficiency. Blood transfusion is now falling out of favor. Why? Because we have the new human ESA. Why is blood transfusion bad? A lot of side effects. Iron overload, infections, alloantibodies.
Now, applications in medicine. Targt, a new autologous protein delivery platform designed to provide sustained secretion of proteins such as recombinant human erythropoietin, uses a small autologous dermal explant or explants in which several biopsy samples of a given patient's dermis are transduced ex vivo with the use of a helper-dependent adenovirus system that is engineered to carry a gene, in this case EPO, which encodes the human erythropoietin protein.
Many human diseases are caused by defective genes and improper protein functioning. Genes within our DNA provide the blueprint for the production of proteins. Specific gene defects or mutations can result in reduced or inability to produce a functional protein, or production of a protein with altered function. Gene transfer using adeno-associated virus, or AAV, vectors can target specific cells to correct disease-causing improper protein function. Once inside the target cell, therapeutic genes within the AAV can correct defective or missing protein function. To achieve this, AAV genetic material is replaced with a therapeutic gene to restore natural function of the disrupted proteins. A protein shell, called a capsid, encases the genetic material and helps target delivery to certain cells. Once within the target cells, the capsid is shed inside the nucleus to release its vector genome. The vector genome does not integrate into the nuclear DNA, but instead forms an episome. Episomes are not passed on to future generations of cells, thereby ensuring that the effect of the gene transfer is not passed on. Using the body's natural machinery, this allows stable and long-term expression of the therapeutic molecule. AAV-based vector delivery systems can be administered by intravenous drip or direct injection to target tissues. AAVs are ideal vectors for gene transfer, as they are non-pathogenic and capable of transducing both dividing and quiescent cells. The different components of AAV-based gene transfer can be switched to address different therapeutic targets and diseases, and several studies and clinical trials have indicated that there is activity in different disease models. Gene transfer offers the potential of long-term and potentially curative benefit to patients with genetic or acquired diseases by correcting defective or missing protein function through a single administration. uniQure is committed to developing innovative and cost-effective single-treatment gene therapies with potentially curative results.
Now, pros and cons. Pros. There were no serious adverse events related to Targt and no signs on either histologic sections of Targts exercised from patients or assays of anti-erythropoietin antibodies of the immunogenicity to either Targt of the erythropoietin secreted of Targt. Cons. This early study does not allow us to assess the risk or benefit to Targt as compared with administration of recombinant erythropoietin injections. Such an assessment will require a prospective randomized trial. Issue applied in Ecuador. Ecuador is one of the few countries in Latin America where its government and the public health system does not count with genetic services in their hospitals. World Health Organization recommends the processes of gerotesis for each 100,000 inhabitants in Latin America, which means Ecuador needs 15, but currently we only have 10. And finally, the conclusion. All patients who underwent Targt implantation had an initial increase in plasma levels of erythropoietin and plasma levels of hemoglobin, remained above or within the desired range of most patients. The plasma levels of erythropoietin remained stable within the psychological range. And the last video.
Blood is very important to the body. It's made up of different elements. Red blood cells supply oxygen to cells and tissues and remove waste. White blood cells fight infection, and platelets control blood clotting. Unfortunately, there are inherited blood disorders that keep the blood cells from doing their job, making it harder for the body to function. Since the disorder is inherited, it is caused by a faulty gene within the red blood cells. Researchers are developing a gene therapy that can potentially correct the faulty gene in patients with beta thalassemia, sickle cell disease, and Fanconi anemia. But first, let's talk about the root causes of these three disorders. Beta thalassemia is caused by a mutation in the HBB gene. This reduces production of hemoglobin, a protein that red blood cells need to carry oxygen. Less oxygen in the body causes weakness, fatigue, and slowed growth. Sickle cell disease is also caused by a mutation to the HBB gene. However, this mutation causes the hemoglobin molecules to be formed incorrectly. Instead of being flexible, they become rigid. This slows blood flow, causing fatigue and carrying the daily risk of severe pain episodes, difficulty breathing, or stroke. Fanconi anemia is caused by a mutation in one of several genes. The disorder stops the bone marrow from making enough red blood cells, white blood cells, and platelets. Now let's understand how an ex vivo gene therapy approach can target these faulty genes to help a patient's body function properly. Ex vivo means that a part of the treatment occurs outside of the body. For more on this treatment, here's Dr. Jennifer Adair.
First, the patient's hematopoietic stem cells, also known as HSCs, need to be removed from the body. Stem cells are an undefined cell that can become different cells depending on what the body needs. HSCs are our blood-forming cells that create red and white blood cells and platelets. HSCs are primarily found within the bone marrow, but can be coaxed into the bloodstream for easier collection and removal via a blood draw.
A vector, which is often a virus, is how the working gene is delivered into the HSCs. Don't worry, the viral genes that are known to cause disease have been removed. The HSCs are then returned to the body, helping to correct the disease. This method aims to be completed only one time. Researchers continue to develop gene therapies designed to be safe and effective enough to improve the lives of patients with inherited blood disorders. For more information and resources about gene therapy for blood disorders, visit asgct.org.
That was all. Thank you.